This is such a wonderful day, Dr. Washington, to be sitting with you. And you are one of our 8 super special businesses that will start the season off. And we're so honored and humbled that we get to chat with you for such a time as this. So, Dr. Washington, if you would intro yourself however you want to be referred to, and the name of your business.
Sure, yeah. Well, I'm first of all very honored that you picked me. So I'm Angela Washington. I like to go by Angela. I've been a nurse for over 30 years. I am also a nurse practitioner, and I have a business. It's called Everglow Functional Health that I have just recently started. I've practiced in healthcare for a long time, but I became interested in functional medicine, which we'll talk a little bit about later. Several years ago, just kind of hit and miss, looking at things and thinking that's something I really like to do. It's often called root cause medicine, so instead of just sort of treating a symptom, it's about getting to like kind of the basis of what is even triggering these problems. And I found that fascinating and important. And so I started that business.
Wow. When you said Everglow, ever means ever.
Yeah.
And then when you said root, you can, if the root's right, be ever.
Yeah.
Girl, give me a high five, doctor. I got it. I mean, it's doable.
Yeah.
Because everything stems from the root. I got it.
Yeah.
I'm getting it. Oh, thank you. So how did you decide to go into this field? I know you said you've been in decades, but this is different, looking at the root instead of dealing with just the fruit. Words are powerful.
They are powerful. So years ago, I guess when I became a new nurse, I always thought, gosh, this is crazy that people are this sick. A lot of it's what we're doing to ourselves, and we're just treating this stuff with medications that don't really make people get better, and people get sicker and sicker. And sometimes have poor quality of life because of their illness. And so I always, my entire nursing career, have thought I would rather do things to help people get better or to prevent illness. Okay. And so I started my master's program in 2003, and I started as a family nurse practitioner track, and I thought, this is what I want to do. I want to do prevention, wellness. But within a year, I realized that was not kind of what I was going to do. And I took a side track over to do my PhD in nursing and got into research and got into history, historical research, and race and social determinants of health and equality in healthcare. So that kind of a side note, but I always in the back of my mind knew I wanted to help people get well and not be dependent on meds and treatments, etc. So as I was learning to become a nurse practitioner, I dabbled a bit and followed many providers that do functional medicine, and knew kind of early on that that would be what I wanted to do ultimately with my NP. So
Praise God. And I can be a witness, I'm a knower regarding your compassion to make people feel better and do better, because I've always been in awe how you give good eye contact and you can sense if that person wants what you are willing to help them with, and you don't hold back. I'm so grateful. You guys don't have, I mean, this is not normal for us. I'm just talking about what I'm talking about, because Dr. Washington has talked to my peers online and just gave her opinion about things, and it has proven to be quite helpful. So where's your business located?
So it's primarily telehealth, so I do it out of my own home, much of it. I do have offices that I'll be able to use, one in Covington, and then I think I'm going to partner with a coworker from University of Louisville Hospital, possibly in her clinic that she has in Louisville. So there'll be some options for in-person, but much of it's telehealth, so it's Zoom type interactions.
Okay, so like if I were to be one of your patients, so do you do blood work, or you just look at me and say, "Child, you fat"?
No,
not
yes,
really.
ma'am. No, there's definitely blood work. So
Okay.
A big part of functional medicine is diagnostics and trying to find out what is the root of your symptoms, what is going on. I'm just going to give like an example. Let's say that you had lupus. Lupus is an autoimmune disorder that your body isn't just genetically predetermined to turn on the lupus. It does that because of what you're eating, your health style habits, your environmental toxin exposure, that kind of thing. So we would not remove meds or stop what your doctor's doing, but work with your doctor to get diagnostic tests to look at your gut health, your thyroid, your things like that, and see what we can do naturally with diet, lifestyle changes to either minimize the amount of meds you need or maybe even come off of them altogether and get you back to a healthy state.
That's amazing. So literally you would have a team working with you.
Pretty much, yeah.
That's amazing. That is amazing. Yeah, I may need to do that, but you have to want to change what you're doing.
Yeah, so I think we were talking earlier, it's kind of a hard sell because in the US we've gotten accustomed to a quick fix for everything and medicine for everything. And historically, when it comes to functional medicine, it's probably best to talk a little bit about traditional medicine and how we got to where we are.
Yes.
So historically, there were all kinds of people practicing what would have been called medicine back in the day.
Okay.
1800s, even before. There were healers of various types, and pretty much anybody could set up shop and be like, hey, I'm a healer. It wasn't until the early 1900s that there was more strict rules put on who could be considered doctor, how long did the schooling need to take place, that kind of thing. And so with that, then well into the 1900s came along pharmaceuticals. There really weren't much in the beginning of the 1900s, but over time, we got more and more medications. Now we got a ton of medications. So within that system, you have who can be considered a provider or a doctor to practice medicine. It ended up going heavily on prescriptive services because that's kind of what we had to heal people or to get people better. And so the pharmaceutical industry sort of grew. And with the pharmaceutical industry came the whole research industry, which is, everybody's heard the gold standard, which is your random controlled trial, medication trials, where they look at, does this drug do what we say it can do, et cetera. And lots of money goes into that kind of evidence for healthcare. Yes. But it's all geared towards the business of healthcare. So pharmaceutical industry doesn't spend money on research that doesn't give them more money back. So for instance, right now, there's little research for new antibiotics because you're only on antibiotics, a week, 10 days? Yeah. So they're looking, we don't want to spend money on that. We want to spend money on research that's going to be, a pain pill that you might need for a long time or a blood pressure pill that you'll take the rest of your life. And it's not like that there's a deviance to it. There's not like a nefarious component. It's just when you're talking about money and how business runs, like it makes sense that you're going to put money into that thing that's going to make more money over time. So that's how we've gotten to where we are. Physicians are very limited. Healthcare providers, I should say, because nurse practitioners are in this as well in your traditional medical field. They're very limited on how many patients they have to see. Lots of people throughout the day for insurance reimbursement, all that. And so they're very reliant on a drug. The pharmaceutical industry talks heavily to the providers, the licensed providers, about which pills, this great thing, the latest, greatest pill for this ill or that ill. So that's how that whole system has come to be. Wow. And there's really no money into research that looks at, let's get down to the root. If you change your diet, you change your health habits, can you get better? There's really no research on that.
Wow.
So it's considered somewhat sort of, I don't want to say fluff medicine, but sort of this alternative medicine because of that, because it doesn't stand within that framework of random control trials, all of that. Yeah.
Yes.
So functional medicine, it is definitely healing as opposed to treating. And I believe that we were all created to heal. So that's kind of the basis of my business, is that I believe God created us with the ability to heal. Sometimes completely, sometimes maybe we don't. It depends on how far the damage is done. Maybe we don't completely heal, but we heal somewhat. I believe that. And so functional medicine goes back to that. Like, what can you do to heal yourself?